You're going to make an important choice about whether or not to go forward with living donor liver transplantation. The purpose of this video is to educate you about that choice. The benefit of living donor transplant for the recipient is that they can get transplanted sooner rather than having to wait on the list. As a potential donor, we want you to be informed about the process of being evaluated, the process of the surgery, and the risks associated with the surgery. While the information in this program is standard, please bear in mind that each transplant center is different and may operate under a different protocol than the one that you see in this video. We welcome you to begin the learning process and encourage you to ask all your questions about living donation.
It was 4 days before Christmas in '07, and my dad went for a routine checkup because he had kidney cancer and they removed one of his kidneys. So they found a tumor in his liver, so that's how we found out.
We've been friends for 12 plus years. We met in our neighborhood through mutual friends, and we hit it off, and we've been close ever since.
They had some concerns. They were afraid that something would happen to me, and I wouldn't be there for my son or for my family. So they were scared. When my dad told me he didn't want me to do this, I told him he had no say in the matter, that I was going to do it anyway.
As the transplant coordinator, I'm the first person you meet when you come to the transplant center to begin the evaluation. I prepare you for the process and help you through it.
Carolyn?
Hi.
Hi, I'm Diane LaPointe-Rudet.
Hi, Carolyn.
Nice
Hi,
to meet you.
Erin.
Nice to meet you. Why don't you come back?
It's very important for you to bring somebody with you to the living donor evaluation because there's a lot of information being put forward towards you and it can be very overwhelming. And so you're going to want somebody there to help you to know the right questions to ask so that you're prepared as much as possible.
Yes, I wanted to find out everything that I would have to do, the process I would have to go through. I wanted to also be prepared for when I did go into the hospital to be tested, to have some questions answered that they were going to ask me.
Have you reviewed the written information that we sent you?
Yes, here you go.
Great, thank you. We ask you to sign a consent to begin the evaluation, and we do that because it's important to review the evaluation process ahead of time and to know what the donor surgery involves and what the recipient surgery involves. It kind of helps you to just get some background information. It's also important to realize that the donor evaluation itself can have some risks. We may find out that you have a medical problem that you didn't know about. And knowing about that medical problem can affect your ability to get life insurance or health insurance in the future. So we just want you to be aware of that before we begin the evaluation.
Okay.
Okay, do you have any questions yet?
No.
Okay.
Your evaluation will be set up according to the guidelines at your center. The idea behind the Living Donor Advocate is that they're there for you. Their whole focus is on you as the donor. They're not connected to the recipient. And so they're really focused on taking care of you.
I don't know the recipient, and I don't know the recipient on purpose because my job is to take care of you. And all the people you're going to meet today are on the donor team, and they're your care team. And we're going to evaluate you very carefully and make sure that you're healthy enough to be a donor. And your dad will have his team, the recipient team, who will take care of him and focus on his health. Okay? And after the evaluation is done, if you decide the risks of the surgery are too high for you, that's okay. And if we decide the risks are too high, we'll say no. And whoever says no, it's okay to decide not to be a donor. So I'd like you to keep your mind open to everything that you're learning about. And then after the evaluation is complete, if you're medically cleared and want to be a donor, then we'll help you through it. Okay?
Okay, this is something I really want to do.
Okay. All righty. Do you have any questions yet?
No.
No.
Okay. During the evaluation, you're going to meet a lot of people. You're going to meet a transplant coordinator, a surgeon, a social worker, and some programs will even have you meet an internist or a hepatologist. And all of these people are going to evaluate you very carefully, make sure that you don't have anything that would make you higher risk or that you don't have any liver disease that we didn't know about.
As your surgeon, I'd like to tell you a little bit about the evaluation of the donor as well as what's involved with the surgery and the kinds of complications that have been seen at your center as well as nationwide and worldwide. I'd like to talk to you about what you can expect in the typical recovery and any other questions that you might have in terms of work or other things that are concerns for you?
I was a little worried about the pain and how much I would be in. I wanted to know how long I'd be out of work.
The donor evaluation first involves determining that you're a compatible blood type to your dad and that you have no major medical problems. And we'll do that through a series of laboratory tests and medical evaluations that will be performed by a doctor who's independent of the transplant team. He's there to really be your advocate and assess that there's nothing wrong with you. So Carolyn, in order to understand the surgery, it's important to understand a little bit about the anatomy of the liver. And so we're going to look at this picture here. The liver has two major lobes. It's sitting up in the right side of the body under the diaphragm. It's protected by the rib cage. And the green thing is the gallbladder. If we drew a line from the gallbladder back to the main outflow, this is the right lobe of the liver, and this is the left lobe of the liver. In most people, the right lobe's about 60%, and the left lobe is about 40%. So we'd be taking your gallbladder out as part of the surgery because it's sitting in the division plane, and then we're actually physically dividing your liver into two segments. One part that will stay in you, and the other lobe will be removed and transplanted into your dad after his entire diseased liver has been removed. Do you have any questions about that part?
So you'll divide my liver?
Yes. Unlike a kidney donor where we have two kidneys and you're donating one whole kidney, you only have a single liver. So we're physically dividing your liver into two portions, one that stays with you and one that we remove, and that's what's transplanted into your father.
And it'll grow back?
Yes. So the liver has two major lobes to it, the right lobe and the left lobe. The blood coming into the liver has two different sources. There's the portal vein, which brings in about 70% of the blood flow into the liver, and it's collecting all of the nutrients that are absorbed from the gut, so the liver is the first place that those go to. The blood then comes in through the portal vein and divides into a right branch and a left branch. The oxygenated blood comes in and divides again into a right branch and a left branch. The blood leaves the liver through a series of veins, the right hepatic vein, the middle hepatic vein, and the left hepatic vein. A common reason why an otherwise healthy person like yourself might not be suitable to be a donor would be related to your anatomy. Those are things we can't change. So for instance, the lobe of liver might be too small for your dad, or you may have blood vessel anatomy that we don't feel is safe to be able to safely divide your liver into two segments. And so that's why the imaging studies like the CAT scan or the MRI are so important.
And what would that show?
The imaging studies show us the size of your liver. It allows us to determine how big your right lobe is and how big your left lobe is. We know we need to leave you with at least 30% of what you started with, and we need to give your dad enough liver volume for his body weight. So your dad is about 70 kilograms, which means we need to give him somewhere on the order of about 700 grams of liver tissue in order to be sufficient until it can start to grow. It really depends on how sick he is. So the amount of tissue that we need in terms of the liver for the recipient is based on their severity of illness. So the sicker a person becomes, the more liver tissue they need. And that's why not everyone is a candidate for a live donor liver transplant. The scan allows us to actually look at the blood vessels that we talked about. And it's the location of these blood vessels that determine where we would actually divide the liver and whether we can technically do that safely, leaving a healthy portion of liver for you and ending up with a portion of liver that we can reconstruct in the recipient. Once we know where that division plane is, we can then calculate exactly how much liver tissue we're removing from you and how much liver tissue we can expect to give to the recipient. So if you're a donor, Carolyn, we have to remove your gallbladder as part of the operation because it's sitting in the division plane between the right and left lobes of the liver. How do you feel about that?
I'm fine with that.
Since we're taking your gallbladder out, and it's a normal gallbladder, you don't have any reason to have your gallbladder taken out, sometimes the donor can have some problems with loose stools or diarrhea postoperatively.
I heard that was common.
Sometimes we have to put the donor on some medication if it doesn't get better on its own in order to help with the diarrhea. It's not something that you're going to be on permanently, it's temporary, but sometimes we do have to put donors on that kind of medication.
Okay.
At this point, there have been about 2,500 of these operations done in the United States where someone is having this surgery specifically as a donor. Of those 2,500 people, there have been 2 donors who have died, and there have been 3 donors who have needed a liver transplant as a result of complications. So the likelihood of having something catastrophic happen, either dying or needing a liver transplant, is about 0.5%, 1 in 200 people. So there's a 99.5% chance that you'll be fine. The likelihood of having some kind of complication is actually about 40%. So those complications are graded from 1 being the most minor to 4 being death or needing a liver transplant. Most of the complications are minor complications, about 90% of them. So they could be things like a wound infection, where we have to open a small area of your wound and have a visiting nurse come and do dressing changes, or it could be a urinary tract infection, or it could be an area of numbness on your fingers from the way your arm was positioned in the operating room while you were asleep.
I could get treated with medication, right?
If it was a urinary tract infection, yes, we'd treat it with antibiotics, or some of the other things require medications, but many of the complications will get better just by themselves. A major complication is typically defined as a complication that requires some sort of procedure to be done to you in order to fix the complication. So what I'm referring to there is, for instance, having to take you back to the operating room for bleeding, or having some sort of injury to the lobe of liver that's staying in you, or having a blood clot in your leg that could go to your lung. That's a potentially fatal event. So these are very unlikely to happen. They happen maybe 1% of the time, 1 to 2% of the time, but they do happen. The reason why we have this face-to-face meeting is so that you can hear exactly what's involved in this kind of surgery and the complications that have been associated with this operation. Even though we're talking about small percentages, they still can happen, and everything for you is a risk because you don't require this surgery. You have no medical reason to have this operation. So it's important that you understand what's involved and understand the likelihood of what could happen. Despite all the testing that we've done on you, we could still get into the operating room and find something that we feel is unsafe to continue with the operation. And in that case, we would stop the operation. The chances of aborting the donor operation is very unlikely. Nationwide, it occurs about 5% of the time. But if I felt that there was something that made it unsafe to continue with this operation for you, then we would stop. One of the more common major complications is that cut surface of liver can leak bile. Sometimes we leave a drain in the donor. We leave that in for several days. We're looking at the color of the fluid coming out of the drain. If there's any bile in the drain, which is kind of a brown color, then we would just leave that drain in until it stops.
What if I still have it when I'm ready to go home?
Well, if you go home with the drain, then when you come for one of your post-operative visits to the office, once there's no bile in the drain, I'd take that out in the office. Sometimes we have a situation where you've already had the drain come out because there wasn't any bile in the drain, and we can find that you've had a bile leak after that. We usually find that on one of our imaging studies. And if that's the case, we'd have the radiologist put a drain into that collection to drain it. Usually if we drain the bile leak, the leak will seal itself, and then the drain can be removed.
How long will I be in the hospital?
You'll be in the hospital anywhere from a few days to a week after surgery. I want to make sure that you understand that we can't guarantee that the outcome of this operation will be successful for your dad.
Yes, we're aware of that.
Your dad has hepatitis C, cirrhosis, and so we won't be curing his hepatitis C with the transplant. The hepatitis C will reinfect the new liver as it did the old liver, but we can't guarantee that the new liver would be destroyed by the hepatitis C the way his original liver was. Your dad actually faces about a 1 in 10 chance of dying with transplant, whether we did a live donor transplant or a deceased donor transplant. The obvious advantage of the live donor transplant is that we're able to transplant him when he's in the best possible medical shape that he can be in, instead of having to wait to get to the top of the list for a deceased donor liver. In the unlikely event that we've taken your lobe of liver out and your dad dies during the operation before the lobe is transplanted into him, would you in that circumstance allow that lobe of liver that you've donated to be given to another patient on the waiting list versus being discarded?
Yes, I would want someone to have it.
Okay. Anytime you have surgery, you have the possibility of developing a hernia in the incision. A hernia is a hole in the abdominal wall. It presents as a bulge, and it's something that would need to be fixed with surgery. That can happen about 6% of the time with this type of surgery. Sometimes we do have to leave a tube in your nose in order to keep your stomach decompressed. If we do, then that tube typically stays for a day or two, and then we'll take it out once you start to have normal function of your stomach. I need to explain the incision. The size of the incision and the type of the incision that we make depends on the size of the donor and also how much liver tissue we're planning on removing. So if you stand here, I'll show you what the incision would look like. So depending on which lobe we take, we may make an incision that's straight up and down like this.
Okay.
Or sometimes we have to make an incision that looks kind of like an L, so it goes like this and like this.
Okay.
All right? For people who are very petite through here, sometimes we need to make an incision that almost looks like a peace sign, like that. But we try to make the smallest incision possible in order to safely take out the lobe of liver that we need to take out.
Okay. I cared more about saving my father's life and having him around for my sister and I, my mom, his grandkids, his brothers and sisters. That was the most important thing to me. It didn't matter what the scar looked like. I was gonna do it anyway. Yeah.
Carolyn said that it would be a backwards L scar on her stomach, and it wasn't going to bother her. She was saving her father's life. The scar is a conversation piece. She'll offer to show it to people.
Typically, the donor operation starts first, and the donor's in the operating room somewhere between 4 and 6 hours, depending on their size. The recipient operation usually starts after the donor operation is underway, and that operation typically lasts about the same amount of time. Post-operatively, we'll be working with the anesthesiologists as well as doctors from the pain service to control your pain adequately. It's important to realize, though, that we can never completely eliminate the pain, but we will certainly be able to control your pain.
They explained that everyone has a different tolerance for pain, and they would take care of it and make you feel as comfortable as possible, that you shouldn't be in pain, and to tell them right away.
When you switch over to pain medicine by mouth, that can be a very uncomfortable day because you're kind of between two different pain regimens. So that's a day that it's important for you to realize that we have a lot of people in place to help manage your pain control, help manage nausea, or any other things that you're feeling that day.
I think I have a high tolerance for pain.
We have social workers and psychiatrists who are also available because sometimes post-operatively the donor can feel discouraged. You're an otherwise healthy person who wasn't feeling badly when you came into the hospital, and now you've had a huge operation. So you can sometimes feel like you're not recovering as fast as you thought you would, and that can be discouraging. When you go home from the hospital, you're certainly not bedridden, but you're really not in any shape to be doing much of anything those first few days.
Erin lives downstairs for me, so she's gonna help me.
I'll be around, and other friends and family will be around to help also.
Good, because even just getting up and getting yourself showered is going to be kind of a big deal when you first get home. You're certainly going to need somebody to help you get your meals, and you cannot drive the car for at least 2 weeks after surgery. You need to be able to twist and turn to look out the back windshield, and you certainly can't be on any narcotic pain medication if you're driving the car.
I thought the recovery would be, I would be up and about faster than what they said. They said that everyone's recovery is different, so I assumed that I'd be up and running in 2 or 3 weeks. I'm used to doing everything myself, and it was hard sitting there and watch other people help me and do laundry for me and help take care of my son. That was kind of hard.
Now, you're not going to be able to do any heavy lifting or strenuous exercise for at least 4 to 6 weeks. And since you're a mom, I think it's a good idea that you make some arrangements before surgery for someone to help you out with things related to your child. dropping off and picking up from school, things like that. Because those are things that you're really not going to be able to do for at least 3 to 4 weeks postoperatively.
My sister will be helping with my son. He's going to stay with her for a while.
That's a good idea. During the first 4 weeks, the donor really feels tired, and that's actually what they complain about most. So you may find that first thing in the morning you have a lot of energy, you're able to do a few things, and then you may find that you need a nap. After the nap, you have some energy again, you can do things for another few hours, and then you might find that you're getting tired again and need another nap. That's normal.
When will I be able to go back to work?
Usually it's about 4 weeks before people are starting to feel normal again. By then you're getting out more, you might be going out to the movies or out to dinner. But usually most people don't go back to work until they're somewhere between 6 and 8 weeks out from surgery. Some patients take longer than that. It really depends on the kind of job you have and what you need to do when you go to work. The biggest complaint that people have after this type of surgery is feeling very tired. The vast majority of your liver growth is actually going to happen during the first 1 to 2 months after surgery, but you'll continue to have liver growth occurring throughout the whole first postoperative year. During the period of time that your liver is regenerating, we'd like it to have the best possible environment. So we'd like you to live a healthy lifestyle, and we would also like you to limit the amount of alcohol that you use during that period of time. We're going to be following you at regular intervals for the first 2 years after surgery. During the first year, we'll follow you very closely. The first week after you're discharged, then again at 1 month, 3 months, and 1 year postoperatively, and then we'll follow you again the following year after surgery. Obviously, if you have any problems or complications, we're going to see you as many times as we need to until the problem's been fixed. It's absolutely critical that you come to those appointments because we want to make sure that you're recovering appropriately.
Sure, I can do that.
Great. Do you have any other questions that I haven't answered?
No, I think you covered everything.
Well, there's no decisions that need to be made today. The purpose of today was to give you the information so that you could go home and discuss this with your friends and your family and decide whether or not this is right for you to do.
Our research is promising and has told us that adult-to-adult living donor liver transplantation is a safe and effective therapy for both the donor and the recipient. The transplant community is committed to gathering further information about both the donors and the recipients who undergo these operations so that we can provide better care in the future for both the donor and the recipient.
The donor evaluation process is overwhelming. As the social worker, my role is to help you process all of the information you've received, identify what your questions are, and help you get those questions answered. Hi, my name's Matt, and I'll be your social worker. It's my job to advocate for you and also help you make sure that this is the right decision for you. It's very important that you know if you have any doubts, you can decide not to do this at any time, even up to the day of surgery. And your reasons will be kept a secret.
No, this is something I definitely want to do.
Okay. Have you talked to your employer about this yet?
Yes, and they're 100% behind me. I explained to my employers what was going on and about that my dad was sick and this was an option, being a living donor, and what they thought about me taking time off. And they were 100% behind me. They had no problems. They told me to take off as much time as I needed. I felt very strong that I'd be able to do this and that everything would line up, my son would be taken care of, I'd have the time off of work and still be able to do it financially. So I felt strongly about being able to donate.
The average time frame for returning to work is 4 to 6 weeks, but depending on the complications, it can be longer than that. It's impossible to tell you exactly how long it will be before you return to work. I think you should definitely make sure that you have at least 3 months of time off in order to make sure that you are not at risk for losing your job. This is a very painful surgery, and it's going to zap your energy and probably make you a little grumpy for quite a while. How do you think you're going to cope with this?
I think I'll be fine as long as I have my support system and my family.
So who is going to be your main care partner?
Erin will be, and then my cousin will be staying with me the first few days.
I live downstairs, so I'll help and drive her anywhere she needs to go and take her to appointments.
That's great. Now let's talk about your son a little bit.
My son will be staying with my sister and her family.
As a parent, especially a single parent, It's very important to think about your child and what you're going to tell them. It's extremely important that they are well prepared for what's going to happen. You need to be very comfortable with the people you have taking care of your child or children to make sure that they can take care of them for an extended period of time, and you trust the quality of care that they're going to receive.
There are days that you feel great, that you can go for a walk around the block, you can walk up and down stairs, and then there's days that you can't even get out of bed just because you're tired. You just get very tired from the surgery. So it's important to take naps and just take it easy. And you should walk around and get exercise, but if you feel tired and you feel awful, then take it easy.
I'll have to ask you many questions about your lifestyle. When's the last time you had a drink of alcohol? How regularly do you drink? Do you smoke? Do you have a history of drug abuse? It's very important that we know these questions, one, because we want to make sure that you'll recover well after the surgery, but also in the case of a rare complication, we need to make sure that we'll be able to list you for a liver transplant if your liver fails after the surgery. This can be a very emotionally stressful experience for anyone. It's very important that we know if you've been under a psychiatrist's care for anything, so that we can be prepared to help you if any issues come up after the surgery. In terms of insurance, the recipient's insurance generally covers the donor's immediate costs, but if there's long-term complications, it may not cover that. Do you have your own insurance coverage?
I have insurance through work. I'd have to check on that though.
Please let me know.
Okay.
If you're worried that your financial situation could prevent you from being a living donor, the National Living Donor Assistance Center can assist you in paying for lodging, meals, and transportation. Your social worker can tell you more about this program and help you apply if you qualify.
After your evaluation, I will gather the data from all of the other team members who you met, and I will make sure that you don't need additional testing. And if you do, we'll set that up so that we can make a decision about your donation.
So when will I know if I could be the donor?
Well, the next step is that we meet as a team to go over all of your results, to make sure you're healthy enough to be a donor and that you understand the risks to the surgery and that you're mentally competent. And then I will call you and let you know the outcome of the evaluation. And if you want to proceed, then we'll go from there.
Okay. I would tell you to make sure that you have a plan set up, that you have a support system, people to take care of you, you could take the time off of work, and also be covered financially. I was just glad to be able to help and just to help out. I would do it again in a second, in a heartbeat.